Hello, my name is Dr. Boski Nair. I'm a consultant perinatal psychiatrist working in a community perinatal mental health team in Kenton Medway. I'm going to talk about perinatal depression. Perinatal depression can occur during the antenatal period, that is when the mother is pregnant, and that's called antenatal depression. It can also occur after the mother has given birth, during the first year after birth, and that's called postnatal depression. Often we find that anxiety and depression can coexist during the perinatal period. So what is the impact of perinatal depression on the mother, the child and family? We find that untreated depression can have adverse long-term effects. For the mother, the episode can be a precursor for chronic recurrent depression. For her children, a mother's ongoing depression can contribute to emotional, behavioral, cognitive, and interpersonal problems in later life. We also know that 10% of fathers can experience depression during the perinatal period. So what are the signs and symptoms of depression? We often find that mothers can experience low mood, they can be tearful, they can present with biological symptoms of depression such as poor concentration, reduced sleep, reduced appetites, and reduced interest in sex. We also find that they can present with psychological symptoms which can have an effect on their mind. They can feel guilty, worthless, empty and numb. They can feel isolated and unable to relate to other people. They can have lack of pleasure in life or things that they usually enjoy. They can experience no self-confidence or self-esteem. They can feel hopeless and despairing. Depression can have an impact on their behavior. They can feel restless, agitated, or irritable. They can feel hostile or indifferent to their partner or to their baby. Sometimes we also find mothers experiencing suicidal feelings. Thinking about the treatment modalities for depression. If the symptoms are persistent and subthreshold or mild to moderate during pregnancy or during the postnatal period, we need to consider facilitated self-help. Moderate or severe depression in pregnancy or postnatal period, we need to consider high-intensity psychological interventions such as CBT or medications. Sometimes a combination of psychological treatment and medication can be used. If the woman is on an antidepressant medication, the medication should not be stopped abruptly as it carries a high risk of relapse. The benefits and risks of medications should be discussed with the woman to enable her to take an informed decision on her treatment plan. It is just as important to discuss with the mother regarding self-care, adequate rest, to seek support and ask for help if needed. There needs to be discussion on lifestyle factors that can impact on well-being, such as a healthy diet, physical activity, and social engagement. It is important for mothers to attend mother and baby groups, ask for additional help from their health visitor, family and friends. When do we refer women to secondary care or specialist services? If both medication and CBT have not been successful, the woman's daily activities are being severely affected by her anxiety, or if there are associated risks such as suicidal ideation, intent, or thoughts to harm others, referral to the local specialist perinatal mental health service or community mental health team should be considered.